Salam alaikum, everyone. It's Rasha. I'm with the Muslim Women's Organization. I sit on the board, and I also help run the Muslim Women Organization's Social Justice and Advocacy Committee. We are super, super excited to be on with all of y'all in community because it's definitely social distancing, but I love the hashtag, as corny, as cliche, as cheesy as it is. We are apart but together, because that's real. And knowing how to build together in this time and how to uplift the most vulnerable communities is absolutely essential. So we're counting on all of y'all to lean in and join us in this conversation this evening. We're just going to give it a few more seconds for folks to join in, inshallah, and we'll get started. We have powerful guests talking about ways that people are being impacted by this, by the most vulnerable communities, most disenfranchised, but really ways that we can give back and solutions to these issues. So we're going to get started. Again, if you're joining us, this is Rasha with the Muslim Women's Organization, and we are going to be talking about how COVID-19 has impacted the most vulnerable community and what we can do to be there in community, inshallah. So go ahead, share this link. We want folks to be a part of the conversation at the end, inshallah. So we're just going to take a second to share this link with some of our guests and friends and our members. So feel free to share this link, inshallah. All right, great. So bear with us. We do have a few screens open to be able to stream so many people on Facebook Live. So it might take us a few seconds, inshallah. Bismillah ar-Rahman ar-Rahim. My name is Rasha again, and I'm with the Muslim Women's Organization. We know that these can feel like debilitating times. How do we organize? How do we mobilize? How do we be in community during these times? We're going to talk about all that today, and we want to hear from y'all. This is a Muslim Women Organization Social Justice and Advocacy Committee. It's going to be split in 3 parts. We have our first guest speaker, Rashida Muhammad, who's going to be on the first part of the show. Rashida Muhammad, talk to us. Tell us how you're affiliated with the Muslim Women's Organization, your preferred gender pronouns, and how you're feeling in this moment. When I say how you're feeling in this moment is because we know that each day there's a different emotion that we feel. Even throughout the day, we feel different kinds of emotions. We go through a different kind of roller coaster. But how are you feeling right now as we talk to folks online?
Assalamu alaikum, everybody.
Yeah.
I am Rashida Muhammad. I'm with the Muslim Women's Organization. I'm on the board. And thank you, Rasha. At this moment, with everything that's going on right now, I've always have mixed feelings, but today is a day that I feel sad but hopeful. You know, hopeful that things will turn around quickly, very quickly, but sad that it doesn't seem to be that way.
Absolutely. Thank you, Rashida. We're going to go ahead and introduce some of our other guests before we come back to Rashida. Our next guest speaker, I want to introduce Seema Azim, who has been able to put all of this together, really using this app and helping create the flyer and the graphic and really doing a lot of research. Seema Azim, please introduce yourself and how you're feeling today.
Assalamu alaikum. My name is Seema Azim. I'm with the Health Committee, the Women's Health Committee here at Muslim Women's Organization. Considering the circumstances, feeling all right. Just, learning how to work from home and how to navigate that and be productive. Yeah.
Absolutely. Thank you, Seema. Next up, I want to introduce Sada Davies, who is really going to be saving lives with Seema one day and has done so much already for the community, not just the Muslim community, not just the Muslim Women's Organization, but really so many of our impacted communities. Sada, how are you feeling today?
Assalamu alaikum. I am with the Muslim Women's Organization Gender and Sexual Diversity Committee. And as far as how I'm feeling today, it's, tense, you know, having family in the healthcare field. It's a tense time for everyone, but I'm feeling hopeful, and I'm feeling, you know, grateful for the resources that I do have, and hopeful to make sure that our entire community has those resources.
Absolutely. Thank you so much. And the next person I want to introduce is a very young organizer, but has been a part of the community since birth and really one of the most committed people I know. Syria Lutfi, how are you doing today?
Assalamu alaikum, you guys. I'm Syria. I'm so blessed to have my family and friends during a time like this, and we're in the age of technology and internet, so that's been super helpful to be connected with them through social media, through other platforms, and just being there for a time right now.
Thank you, Syria. So that would be the second part of the show. And then our third part of the show, I want to go ahead and introduce Muayyad, who is a teacher, who's a former colleague of mine at the Civil Rights Organization CARE Florida, who has been so proud to be part of a space like the Muslim Women Organization. And it's really been humbling having you. Muayyad, please introduce yourself and, of course, how you're feeling.
Hello, I am Muayyad Abushanab. I am a middle school teacher at Meadowbrook Middle School, and I am part of the Muslim Women's Organization's Social Justice and Advocacy Committee. I'm feeling anxious, but at the same time, very thankful for everything I have and having my family and, I mean, even the community as a whole. Yep.
Thank you, Muayyad. And next up, I want to go ahead and introduce Zana, who I've been privileged to know from when she was even younger. She's a senior in high school and is already doing big things. Zana, please introduce yourself and how you're feeling.
Assalamu alaikum. My name is Zana. I'm on the MWO Social Justice and Advocacy Committee. My pronouns are she, her. In this moment, I guess, with everything going on, I'm really grateful for my family and my health.
Alhamdulillah. Thank you, Zana. And of course, Ziva, who I absolutely adore and I look up to. Ziva, I'm super excited for folks to actually get to meet you and talk to you. Please introduce yourself and how you're feeling today.
Assalamu alaikum. My name is Ziva Sheikh. My pronouns are she, her, hers, and in this moment, I'm feeling confused because I have so many questions and there isn't really a definite place to go to for answers, but I'm also feeling hopeful. And I know that we can all unite and come through this even stronger.
Thank you, Ziva. We're going to go ahead and start our first part of the show. And Rashida, welcome back to the studio. I want to talk about a little bit how I'm feeling. I think that you were on one of the first phone calls when I was literally in Publix buying wipes, and it was a moment that we all realized what this meant. You know, so many of us at the Muslim Women Organization, thanks to Sadaf, helped make that call happen. And on that call, you know, I think both of us cried on that call because we understood what this moment meant. It was more than just coronavirus infecting people's immune system and actually killing people, but what it meant for the most impacted communities. As an organizer, and to be able to respond to crisis, whether when it's violence that inflicts us or when it is natural disasters. So for me, I felt like a lot of frustration and I remember crying and really holding that space, but wanting to understand how do we channel this frustration? How do we channel something that we know that could have been preventable, is still avoidable, and can still help save lives? But we know that Allah subhanahu wa ta'ala tells us to always continue to fight. So Rashida, you are one of the first people I thought of on bringing on to today's show, is because it didn't take you a minute for you to use your talent, your skill to be able to give back. Like, you always have used fashion and then your platform for fashion to not just give back to young women, but to give back to the community. Considering the limitations and restrictions on resources to masks, you went out and you made some and started to distribute. So we just kind of talk to us about how you came up with that. What made you do it? Were you scared to go out into hospitals and these doctors' offices and clinics to be able to provide and what keeps you going in these moments where sometimes we do feel tired?
Well, alhamdulillah, it all started with just watching the television news, and one of our panelists said it, like using our social media platform. But you know, in a time like this, although I want to keep moving forward with fashion and getting everybody ready for Ramadan or their special events with fashion, it just really didn't, you know, it didn't feel like it's the right time. Yeah, fashion continues, but you know, watching the news and constantly seeing the shortage that's going on, the constant shortage, and the very people that are there to help, the very people that are there to help in the medical field, the doctors, nurses, you know, our community members that have to go to work, our essential workers, they just didn't have what they need. So I just did a sample one, and it went from there. And most of the doctors and the nurses that we've donated to, or the hospitals, I should say, most people have reached out to me before I can even get to the hospitals, because there's protocol with the hospitals where you just can't go and say, here, I have donations. It just doesn't work like that. But for people to reach out to me and say, you know, my hospital needs some, I'm on the COVID-19 testing team and things like that, for them to reach out to me and our team here at Higher Fashions, that meant a lot. That meant that, you know, that was our main focus, to help with the shortage, to help with people so that they can be protected in this time right now. So
what was it like with the first time that you delivered some of the masks?
You said, what was it like?
What was the response like from doctors and healthcare workers?
Well, it's so funny. I wrote a little note in our first donation, and it was just a note from us to them, just like a thank you and some more like some heartfelt words that we wanted to share with them. But the response was, they sent us a very big thank you card. They took a picture so we can actually see them wearing the mask, and they were just extremely grateful. And that was more than what I could expect it. That was way more. My job was just to donate it, just so that they are happy, they have what they need. But to see them actually in the form, wearing something that we've made for them, and actually being able to use it, that was it brought tears to my eyes. I mean, I was emotional, and I often look back at that picture because I'm like, that's just a few people. That's just a few nurses, a few medical professionals at the hospital. But what about many others that have to constantly throw their stuff in the garbage or have to use some kind of bandanas? Like, I hear many stories, and I'm like, if only I had about 50 people in my house to set up warehouse shop, like, I will make it happen. But right now, so thankful to Allah that, you know, I have a good team. My mom, my husband, my sons, we set up shop right here. And as much as the boys never really, you know, always didn't really think that sewing was their thing, well, it's their thing now. So not only am I giving back, I'm happy that they're a part of this. My sons, they are part of sewing. My mom is here. My husband, he's the cutter. and they do, alhamdulillah, we do it so well together. You know, I couldn't do it without my mom, with my whole family right here. So, and a big shout out to my sister in New Jersey. She's doing the same thing, Hamina. I want to give a shout out to her because she's providing people with masks also, and I'm happy for that. So, you know, whatever we can do, we should, and that's just how I feel about that.
Rashida, barakallah fiki, jazakallah khair. So much love for you, and thank you for holding this down for so many people. Literally, you are part of the community that are saving lives right now. So thank you for joining us, and sorry to see you go, but we understand that you have to go, especially in these times, family calls, inshallah. So praying for your family, lots of dua. I love you.
Thank you. Love you too. Assalamu alaikum, everybody. Thank you, Rashida.
Thank you, Rashida. And going into the second part of the show, I want to bring into the studio. How cool is this? Give it up for Seema for really helping us navigate. So the second part is Seema and Sada and Syria. Please welcome back to the studio. Hey, Queens. Wow. Rashida got me going. How y'all feeling about that?
Good.
Yeah. Power. So, one, I do want to kind of bring it up, like, as we are talking about this, we want to remind folks that, I read something on Twitter that said, we aren't working from home. We are in a crisis trying to work from home. So if you don't feel like joining the yoga lives on Facebook on a Tuesday morning, don't do it. If you don't feel like you can mobilize and organize in this time, take that balance, take that break for whatever it is that you need to do for yourself to be able to take care of yourself in this moment. This isn't a time where people have to be called to be activated. This is if you're able to, and if you're able to get through this moment in the way that this is how you want to channel the time that we're in right now. So this is a reminder for folks that there's no pressure. There is absolutely no pressure in being a part of the different task forces that are being part of this community. But we do want to talk about what a lot of the folks on this call with the Muslim Women's Organization Social Justice and Advocacy Committee are doing. So I do want to go ahead and jump in to Seema, who's going to go down. Is Seema or Sada first? Sorry.
Oh, yeah, I'd be going first.
Okay, Seema's going to go talk about just these two are going to be doctors, inshallah, by the way, just so y'all know. So I do hit them up with questions here and there. But no, go ahead, Seema. Go ahead and talk to us about a lot of the things going on in the healthcare field and what people can look out for.
Okay. So first, I just want to touch on, what you do if you do have symptoms for those who may not know. Just quickly, because I know there's a lot of information out there about it. But if you're having symptoms such as, fever, cough, or you've come into contact with somebody who has tested positive, the best thing to do is to call your primary care provider or the Florida Department of Health, if you don't have a primary care provider, and explain your symptoms, However, if you're having unmanageable symptoms, such as the inability to breathe, you should seek emergent medical help right away. And when we're talking about emergent medical help, this might bring up a lot of fear for some people. And that fear is totally understandable. A lot of us have it, at the end of a lot of hospital stays, medical visits, we sometimes end up with these really large medical bills that, like I said, and have this, that come with this fear. So you do have options when it comes to relieving some of the financial burdens that come with seeking medical help. One of those options being requesting an itemized bill. So you have the right to request this and see exactly what it is you're paying for. A lot of the times there's errors in your medical bills, and this results in your bill being higher than it actually is. So it's easier to negotiate healthcare costs when you know what you're paying for, what services you received, what you didn't receive. Another right that you have is that patients have is to request a payment plan. So, if you don't feel like you have to pay a medical bill all up front, when you receive your bill, call the financial department, explain your situation, explain that you want to pay this in installments. You completely have the right to that. The Affordable Care Act protects your right as a patient to this option. So I just also want to touch a little bit on what Sister Rashida talked about. As we know, there's a serious personal protective equipment shortage going on, otherwise known as PPE. This is resulting in a lot of our healthcare workers getting sick, lowering our healthcare capacity. So when we talk about flattening the curve, we hear a lot about social distancing, staying home, and this is our part as the general public. This is the best thing we can do. But another component to this curve is when we stay home, when we social distance, we lower the number of cases. But to be able to treat the amount of cases, we need to have a certain healthcare capacity. So that healthcare capacity is unfortunately being threatened because of the lack of safety that healthcare workers are having right now on the front lines because of this large PPE shortage. So as Rashida said, what's some ways that we can help this? We can, donate masks to hospitals, to healthcare systems, initiatives such as Sister Rashida is doing. We can organize PPE drives, talk to your family, talk to your friends, see if they have masks that they can donate, or if they know of places that have masks. And, when we're talking about PPE, we have to, and we're talking about the safety of our healthcare workers, we have to recognize, who's on the front lines. This pandemic is a gendered issue because 70% of healthcare workers are women. Many of the people on the front line dealing with this pandemic are women, and this is definitely a gendered issue. Issues such as wage gap are seriously highlighted. Black women make 64 cents for every dollar that a white male makes. Latina women make 48 cents for every dollar that a white male makes. These women are facing compounding struggles of regular financial burdens that come with these wage gaps, and then also the financial burdens that come, during a pandemic, but also being on the front lines, risking their safety, putting their families' lives at jeopardy. This poses serious reproductive justice concerns because, these healthcare workers who are women on the front lines are being forced to isolate themselves from their children, separating from their children, this putting their own children in jeopardy, having to not have the ability to parent in safe environments. So how can we help with this? Call your elected officials, voice your concerns, talk to them about these points, tell them to support legislation regarding increased access for PPE, to work on legislation regarding wage gaps, work on legislation for hazard pay for those in the front lines, forgive student debt for a lot of these healthcare workers who are facing student debt burdens. The more we call them, agitate them, let them know that we demand better for those in the front lines, we can contribute to providing safety for them and hopefully mitigate the impacts that vulnerable communities, such as people on the front line, are facing.
Thank you, Seema. That's a lot of helpful information I think that folks really need to hear. I'm going to go ahead and go straight into Sada because I know that y'all have been working together collectively on this, being able to deliver tonight's information. Go ahead, Sada.
Assalamu alaikum. Thank you, Seema, for all that great fundamental information. I'm just going to retouch. I know that we've been hearing a lot about social distancing, but really we're talking about, physical distancing. So limiting face-to-face contact, 6 feet apart, no group gatherings, all these things that we've heard. And so I'll get into later about why we want to do physical distancing and not necessarily social distancing. And then those living in a home with a larger group of people should follow the CDC recommendations to the best of their abilities. So even though you may be living in a home with 6+ people, just limit face-to-face interactions, and then limit interactions with folks outside of the home and maintain as much distance and limit coming in and out of that home. And then I'm hearing a lot, and I'm sure that other folks have been hearing a lot of how it's transmitted, and a lot of folks are saying that it's airborne. How exactly do we catch this? So according to the CDC, it is not airborne. It is transmitted through droplets, and droplets can transmit through sneezing, coughing, or even just exhaling, which is why it's important to disinfect surfaces as much as you can. Try not to touch, your mouth and mucous surfaces, of course. And then the other thing is that the virus can live on certain surfaces for up to 3 days, which is why we want folks staying home, and even within the home, we want to disinfect regularly. And as far as who can get COVID-19, unfortunately, we've seen now that it is not just a certain age group, and it is, all age groups are vulnerable. And when we hear the word immunocompromised, and we really need to remember that a lot of things contribute to compromising our immune system. So for instance, stress and other pre-existing conditions, these contribute to compromised immune systems. And as far as mental health goes, as I said, we're physically distancing, but let's not completely social distance. Stay connected to family and friends, video calling, phone calls, happy hours with the Muslim Women's Association, all these things to stay socially connected to each other, and check on your folks and make sure that everyone's, connected. And then if you are homebound, creating a routine has been shown to give folks a sense of control. And we're living in a moment right now where a lot of people are feeling extremely out of control. And so if you can grasp onto some sense of control and some sort of routine that you're living by, and then getting fresh air, if you are able to, or opening a window and just getting a bit of outside time or a bit of fresh air while maintaining physical distance. Studies also show that even just listening to sounds of nature can have similar effects on relaxing our bodies and turning off that sympathetic nervous system. And then when available, of course, choose nutrient-dense foods. At the end of the day, unfortunately, we're all vulnerable, so we want to make sure that we are strengthening our mental and our physical immune systems to combat this to the best of our abilities.
Thank you, Sada. Thank you, Seema. There's actual videos out there too, that goes along with everything that y'all are sharing. There's videos that teach you how to wash your groceries, all of that, being able to take the next precaution. And Sada, something you touched about is it's not just the older generation that is falling victim to this, and something that we do talk about at the Social Justice and Advocacy Committee is our most vulnerable communities, our most disenfranchised communities. So when I spoke earlier about what I knew this would mean is I knew what this would mean to the most vulnerable communities is that to the Black and Brown communities, right, who will suffer the most often when it comes to the healthcare system. Actually, the Black and African American women, they tend to fall. They are seriously vilified in the healthcare system because doctors don't take them seriously as they would take as serious as a condition a white woman was facing with the same symptoms. So this is something that the Black and Brown community has been impacted disproportionately when it comes to the system inequities and from environmental racism, right, to the wealth gap, to the underlying health conditions that they have because of this system that has disproportionately disenfranchise the Black and Brown communities to where they don't have access to insurance, they don't have paid sick leave, so a lot of times they're deemed as essential workers. So it's just immeasurable how this impacts the most vulnerable communities, the most disenfranchised, the people of color, communities of color. So this is something that, when we're talking about the systemic inequities, we're talking about how this really impacts people that don't have the same access, that don't have the same privilege. And when you're reading about it, more about the deaths, there is an increase of the Black and Brown communities that have been impacted. The death tolls have high numbers. So this is something very serious when it comes to unemployment, when it comes to all of that. The injustices have amplified. And these are all issues that we've been fighting for regardless of Corona. But now when coronavirus hit, we all knew what this meant, and that's why we joined as a Muslim Women's Organization. Before we bring in Syria, we joined a network of organization around community demands around the coronavirus with different social justice and advocacy groups across the state that really anchored this. We signed on to their demands. So the right to safety for our community, for healthcare, the right to paid sick leave, the right to healthcare to our undocumented folks, immigrant folks. We're encouraging people to go out there and talk to your elected officials and pushing policy that's inclusive, that we want to release people from detention centers, from ICE, from jails and prisons, And with that being said, the list of demands goes on for plan for the vulnerable population that we're talking about, and schools, which Ma'ayed will talk about. So I do want to bring in Syria because one of the most vulnerable communities are people in detention centers, are people in prisons and jails. And so we've joined the call on Florida state prisons and jails and detention centers to release people. So Syria, if you can talk to what is going on, how folks are being impacted, and what we can do, or how people can support the Muslim Women's Organization in their partnership with other organizations or people on the ground doing this work.
So as you said, Russia, people entering jails and prisons are amongst the most vulnerable in our society. And during incarceration, that vulnerability is evident by restricted movement, confined spaces, limited medical care. Populations involved in the criminal justice system have an increased prevalence of infectious diseases such as HIV, hepatitis C, viruses, HIV infections, tuberculosis, list goes on. So we essentially know that social distancing reduces transmission. And all around the nation, the practice is being implemented within every aspect to our lives. So for example, schools have gone digital, many jobs have gone virtual, restaurants are partaking in carryout. So looking at it, social distancing is extremely challenging within correctional facilities and settings. According to the U.S. Department of Justice, half of the population of incarcerated folks have at least one chronic disease and are over the age of 60. These factors are terrifying because of the heightened risk for infection these people are at, and with very limited ability to protect themselves by self-isolating or social distancing, we're looking at tremendous amounts of people that are at risk for this severe illness. We obviously know that this virus needs to be delayed for as much as possible, for as long as possible, from being exposed to correctional settings and facilities. And of course, if it's already in there, then it definitely needs to be controlled. So we're so blessed that we have organizations like the Dream Defenders, where they are currently asking police departments across Miami-Dade County for the immediate release of all people who are currently incarcerated on bondable offenses from jails, and to stop adding new people to the jail population. They are also taking measures and asking for the following, which include the release of all people in jail who have fewer than 60 days of their sentence remaining, to stop holding people for ICE after they would otherwise be released, loosen restrictions on GPS and house arrest, create and expand emergency housing for those returning to the community after incarceration, and connect them with a healthcare provider as needed. We can also shed light on the Innocence Project, which has advocated for the release of many people as possible, so to help reduce the number of people who will be impacted by COVID-19 outbreaks behind bars, and has advocated for access to COVID-19 testing, prevention, and medical care for those who remain incarcerated. The Innocence Project has also advocated for incarcerated folks to be able to call families and loved ones and attorneys for free during this pandemic. So for us, there's so many ways, a number of ways that we can get involved and support incarcerated folks during this time, from signing petitions to advocating for better treatment of those who are incarcerated, to donating to community bail funds that are helping to get people who can't afford to make bail out of jail, are extremely important ways that we can help while staying home and doing our part to keep ourselves and others safe. Donating essentially is one of the biggest things that we can do in support for incarcerated folks. As I said earlier, many individuals who are in jail that haven't been convicted of a crime are still there because they are unfortunately cannot afford bail. Donating to your local community bail fund is extremely helpful. Community bail funds help to pay their bail on their behalf so they can be released and await trial at home. So within the midst of this pandemic, reducing jail populations is a huge way to help fight the spread of this virus. Essentially, all of these attributions will help reduce the infection spreading amongst incarcerated folks and limit transmission inside correctional facilities and settings within communities and when incarcerated people are released. I believe that we all have a moral calling to our community, which includes people behind jail walls in the midst of this pandemic. Continued incarceration will be essentially a death sentence, and we really need to stand with the most vulnerable during this pandemic.
That is unbelievably critical information, Syria. Thank you so much for sharing. And it's definitely something that's very hard to digest, considering that there are solutions, there are ways of alleviating so much of people getting infected or being impacted by this virus. So to call on, law enforcement, elected officials, and really people to do the right thing in this moment. I think what's an interesting, connecting it all together, we have been calling on the abolition of ICE and detention centers and prisons and jails. And it's just in the midst of this coronavirus, seeing it all amplified tenfold, I think it's chilling. So hopefully in this time, as we're losing lives, as people are losing loved ones, as people are losing their jobs, as people are being impacted in so many ways, let this sound the alarms for American politics, right? For people that are talking about they don't want to get politically involved or don't understand how the system works. This has impacted every single person, and unfortunately the most vulnerable in even more ways. So this is definitely, I think, a moment where people need to wake up, get activated, even if it's sending an email to their local elected official or donating. On that note, I just want to say that there's a national, I was looking at my phone, I was looking for the flyer, I got texted a couple hours ago. There's a national call to action of what they're calling a drive-through rally around calling on the release of folks from detention centers and ICE centers and jails and prisons. So, that is something if people want to be a part of, we can provide more information. I am just going to include I just put the link of demands that we spoke about earlier. So thank you, Seema and Sada and Syria, for all that information. We might bring them back on after, but we do want to keep the program going. So thank you all. Next on our program is going to be Muayyad and Zaina and Ziva. Welcome back to the studio. So what are y'all thinking of the program so far?
I really like every point that's been mentioned so far, especially when Syria was talking about the incarcerated people. That was very insightful.
Yeah.
I think this is very important. I'm glad we're covering this.
I think it's very important information, especially for vulnerable communities like ours.
Awesome. So Muayyad, you're a teacher, and one of the demands that we are calling on the state of Florida is resources. One of the first things that came to mind when I was realizing that this COVID-19 was real is how children will go hungry, right? Because they're not receiving free meals, and also being at home isn't sanctuary for all people, right? From abused children to survivors of domestic violence, and how this impact all of this when their parent might not have the resources or have spotty Wi-Fi, or the environment of education changes, right? The safety net for so many students, and it compromises their education. So if you can speak a little bit to that issue.
As Russia just mentioned, the coronavirus impact on education is huge, mainly on communities of color, right? Because the achievement gap in education, the achievement gaps between students of color and white students is one of the fundamental problems in our educational system. Due to the coronavirus, this gap is just expected to become wider, especially in regards to Black students. Because when we look at the achievement gaps between white students and Black students is the largest. And this is due to a couple of reasons. First, access to Wi-Fi. Second, access to technology such as laptops and tablets, especially for elementary and students. since middle and high school students are provided laptops by district. Third, help from parents. This is especially impactful for Latinx communities that make up 43% of the student population in Orange County public schools. Fourth is the low-income families. This is for two reasons. Parents are probably still working because a lot of low-income families, a lot of their parents are or families are in service jobs, and many of those service jobs are still operating. So they either have to find someone to take care of their kids at home, which means that they cannot help their child. And for the second reason, if they are at home, they're probably struggling to make ends meet, which makes education educating their child as a last priority. Finally is the access to meals, which is what we hinted about earlier, Russia. So these are obviously different problems that are affecting the education of students of color during this pandemic. So I gathered some solutions that might help deal with these issues. When it comes to, for example, when it comes to the Wi-Fi problem, Spectrum is giving students free access to Wi-Fi for 60 days. However, this is not well advertised, so we all need to do a better job with that. Second, in regards to access to technology, schools are offering students the option of paper-based instruction, but perhaps nonprofits need to also build partnerships to give students an option to borrow laptops or tablets. This is very important. Not only even if students have a paper-based instruction, they still need to look up certain things to do better with their assignments. Third, in regards to help from parents, I believe the solution for that would be to build how-to guides in different languages to help parents understand the basics of distance learning. For example, how to use Canvas, but that instruction would be in Spanish, for example. Third, for low-income families, financial support is needed, which is something that many organizations do offer, but it's not as well advertised. Finally, in regards to access to meals, OCPS offers students free grab-and-go meals at certain schools. The meals are available for pickup, but it's definitely not well advertised as well. So if we can get that out to the community and let them know where are the sites where students can go and pick up the meals, I think that would be a great benefit to our community. Yeah. So those are the problem solutions. Russia went, but oh, here you go. I was like, where do you go? All right.
As you talk about Wi-Fi issues, right?
Exactly.
No, I really do appreciate you. I could still hear you, by the way, because I was I have the Facebook on MWO open. I think, this, again, to reiterate, it underscores how I think elements of coronavirus that people wouldn't even imagine, how it really leaks into people's lives, and it's life-changing. So especially for younger people trying to get this education, the Florida educational system already is shot. And now under these conditions for, like you said, the Black and Brown and Latinx and these communities of color, what it looks like. So the information that you shared is super helpful. And we did talk, and we said that hopefully as days go on, we can find more organizations or more efforts, inshallah, where people can provide to help a lot of these students. So the resources that you did share today is super helpful. Thank you, Maya. Azana, one of, I think you and Zivai actually met you all when I worked for a civil rights organization at a time when Islamophobia was up by 500%, post-Trump era, post-Trump administration. So a lot of our conversations from the front were about racism and discrimination, and how there's always a group of people, no matter what, that, the right wing, or that they want to be able to blame and inflict harm and violence. So I know that y'all are doing important work as you build your Surge magazine, and you're using that to talk about the racism and discrimination that are impacting people in light of coronavirus. So if you all can talk a little bit to that, and what's going on, what we're seeing, and how we can fight and push back against that.
Right.
Okay, so recently there's been a lot of anti-Asian stigma because of the sudden prevalence of the coronavirus in America. And the cases that I'm about to talk about are just a few reported cases out of 650 direct reports in only the past month. So on March 11th, an incident in New York took place where a Korean woman was punched in the face, grabbed by her hair, and yelled at for not wearing a mask while entering a building. There have been reports of bullying and racist taunting in public schools as it's revealed that these disgusting acts of xenophobia and racism are not hindered by age, which is actually a point that Moya mentioned earlier. In California's San Fernando Valley, high schoolers physically assaulted a 16-year-old boy and accused him of carrying the new coronavirus. And in the case of older students, universities have received criticism.
It's outrageous.
Yeah. But for the case of older students, universities have received criticism for normalizing xenophobia and providing inadequate support for Asian students who might be on the receiving end. So it really affects students of all age. It's really disgusting that it affects younger people at all. And this harmful rhetoric that seems to be sweeping through America, I think it's very indicative of a simple fact that viruses don't discriminate against people for their racial backgrounds, but people do. And unfortunately, this anti-Asian sentiment is fueled by our own president, who refers to COVID-19 as the Chinese virus. Last week, he started to refer to the COVID-19 as a Chinese virus in a tweet where he says, "The United States will be powerfully supporting those industries like airlines and others that are particularly affected by the Chinese virus. We will be stronger than ever before." It's not just him, because his associates have also referred to the disease as the Wuhan virus and the Kung flu. Senator John Cornyn said China is to blame for the epidemic because in Chinese culture, quotation marks, people eat bats and snakes and dogs and things like that, quotation marks. So I guess what we really need to focus on is how all of this stigma affects the Chinese community in America, because labeling COVID-19 the Chinese virus, it totally fits in with his hostility towards China and his pattern of identifying non-European foreigners with disease in general. He did the same thing with Mexicans when he said that they would bring in diseases when they crossed the border. And representing COVID-19 as invasively foreign also allows Trump to distract attention from his own administration's inability to deal with the virus, and he can then point the blame towards a foreign other. I think that the rise in anti-Asian xenophobia has had tangible negative impacts for people. It's resulted in economic consequences for Asian small business owners because it's seen that in mid-February, with only 15 cases in America and before social distancing policies were in effect, small businesses in Manhattan's Chinatown reported sales drops of between 40 to 80% as the virus started to spread in China. The public treatment of Asian Americans as a scapegoat for this public health crisis isn't without precedent. It's actually seen throughout history, from the Black Death to Ebola, where xenophobia and public health policies have been strongly linked to involve scapegoating a foreign entity or a different ethnicity. So me and Ziva have really tried to encapsulate this injustice in our piece for Surge magazine, which we called COVID Diaries. And through this piece, we're really attempting to give exposure to how the COVID-19 crisis has worsened treatment against Asian Americans.
So as Zaina was saying, Zaina gave you news stories, she gave you facts, but at times, numbers, and we see so many percentages that eventually we become numb to them. We don't really understand just how great this issue is, and that was a problem that we recognized. So we used our platform, which, as she mentioned earlier, is Surge Magazine, and we decided that we wanted people to understand just how great this is and that it is affecting real people in real time. So through Surge Magazine, we created a series called COVID Diaries, and we wanted to capture what it means to be alive during the coronavirus. And as we started getting submissions in, we realized that there was one theme across all of our submissions, and it was this racism towards East Asian communities. And it was a problem that I honestly would never have really connected to an illness. I never would have thought that coronavirus would bring about racism, but it's real and it's here. And I'd like to show that piece. So if I could share my screen. So here we have our magazine, and we wanted to make it look like a diary. So we asked people to submit diary entries, and we placed them into a flip book. So here we have an illustration submitted by a girl named Kiv. She made this herself. And in her words, she says, "I am hurt, I'm annoyed and angry for the facts that some people chose to be so stupid, ignorant, uneducated." She goes in and then tells a story, quote, "The other day, I went to a local gas station. Then someone came in and gave me a cautious look. Then he asked me, where do you come from? And before I could answer, he added in, are you Chinese, Korean, Japanese? I was so annoyed to answer, but he didn't bother to hear me. So he just grabbed his stuff and left as soon as possible." At the end, she says, "It has been more than a month now since the outbreak. Yet I still have people treat me like a virus, calling me Asian girl despite knowing my name. News about racism towards Asians is still coming. I just wish it would stop." Here we have a photo submission and another diary entry. She says, "When I think of masks, I think of protection. I think of heroes. When I think of masks, I think of how my people have been singled out by them. The white man on my train platform doesn't get second looks, but everyone's afraid I'm going to give this country its next disease, as if I go back to China every week, as if all Asians are Chinese, as if America was ever healthy." Here we have another photo submission. And this one, again, reiterates, "You know what would be safer than avoiding Asians in public? Washing your hands." And he also discusses that oftentimes Asians are not represented in Western media very often, and the times that they are, they're in a very stereotypical light, and in this case, a very negative light. Here we have our final submission that relates to this, and this was submitted by a young girl. She explains this picture by saying, "This photograph is my take on what the coronavirus looks like for a Chinese girl and the vile quotes of many people's stories online. The face mask and writing are meant to be a statement against the rise of xenophobia in relation to the coronavirus and a push forward in the hashtag campaign, #IamNotAvirus. While the suds or bubbles that fill the rest of the photograph are meant to be tied hand in hand with my dirty face in correlation to the way many people view the Chinese race in these times. I think the fact that the hashtag #IamNotAvirus even exists says a lot about our current state." I would like to go further into this image because I feel like it is very powerful and it captures a lot. February 1st, an Asian woman wearing a mask is called some not very nice words. She's verbally and physically assaulted after confronting her attacker. March 4th, an Asian man is sprayed with Febreze for standing on the subway. March 10th, an Asian woman is punched in the face for not wearing a mask. And then we have some more submissions here. So that is basically what our series was hoping to encapsulate. I think one thing the one thing I found beauty in through this is that people were able to turn to their art during times like this. As you could see, we got many photo submissions, we got illustrations, and I think that even in times like this, it's important that we turn to the things that give us happiness, that we love, and we find comfort in that. So I feel like what we need to learn from this is that there's one common enemy here. And it's not the East Asian community, it is the illness itself. And I think that the one thing we need to do is come together. We need unity and we need compassion. This virus is not going to go away if we continue spewing hate and not supporting our fellow brothers and sisters. So that's my
Wow. I think that I can't imagine ending this show before we go into Q&A more than those images that bring so much power and beauty really in pain right now. I knew you all were creative and geniuses, but mashallah, sisters, that I always wish I had a artsy bone in my body to be able to deliver, because I believe there's so much resistance in the arts, especially as Palestinian, as you can see behind me. It's a big part of resistance. So I am a true believer that it's a healer. There's resistance. There's also movement in the work of art. And I just ordered my Surge magazine yesterday, and I encourage people to really do the same. Thank you all for doing this important work and for having this conversation. Y'all, this has been so powerful. I thought we were all doing this show to be able to provide information and give people updates on what we've been working on, but really I've been able to heal just in this hour. And I really want to thank my peers and colleagues for creating this space and allowing that to happen for me. And from what I'm reading, so many people that are viewing online. So barakallah fikum, mashallah, inshallah, the MWO, SJA, we hope to be providing this every so often. And I think that after today, I definitely do want to be able to continue this journey with all of y'all. So right now, what's going to happen is we're going to put a link. Seema is going to provide that link for people that have comments and questions, so that we'll give about a few minutes before we really end today's show. She just posted the link. You posted it in the MWO page as well. Okay, so we just want to give people, and then as we're waiting for people, if they do want to join, yes, check out surgemagazine.com/COVID diaries. Even the name in itself is power. And what I wanted to also say is that we at the Muslim Women's Organization, we do have a COVID-19 action guide. It's on our website, so MWO-Orlando.org. All the resource mentioned today, we'll be adding that to the spreadsheet. So please look out for that on our website at MWO-Orlando.org. And just looking at the comments, read some of the comments that we're seeing. We love you all. Great info, super important issues. Donating to community is important. Everyone is so appreciative of all the information. Great points, Zaina. So people really, really did enjoy this. If we don't have anybody that wants to join, I think then we can just spend a few minutes. I do want to go ahead and end the studio. So before we have Mu'ayyad and Zaina and Ziva, we're going to go around and just ask for some last few words from each person, how they're feeling now after we had this deeply rooted conversation in being activated in these moments. So we'll just go back from Ziva, Zaina, Mu'ayyad, going back around the room.
I'm so grateful that we had this. I feel like it brought up many points that needed to be talked about and often go ignored in the media. So I'm glad that we had this, and thank you for everyone who tuned in.
Thank you, Ziva. Zaina?
I feel pretty informed after this, just because a lot of the perspectives that were brought up I hadn't really given much thought to, especially like the incarcerated people and how this affects them, and those in the education system, what their thoughts on this health crisis has been. So yeah, I feel very enlightened and grateful for you guys.
So I feel power, to be honest, because I think there is a lot of power to communication, and when you're able to like communicate with the community and help the community, then we can all come out of this safer and healthier. But if we all just look like at ourselves, then we are gonna weaken as a community, and this is gonna let us all be worse off.
Thank you, Ma'ayed. Syria.
Yeah, so just echoing what all of you guys said, I really feel empowered. I feel just more educated, more smarter about everything going on with around this virus and ways we can do other things that we can look at, different aspects during this pandemic. So I'm grateful for you all for sharing, and I'm grateful for everyone that is viewing this right now and has viewed this for the past hour.
Why do I keep? Oh, I keep getting lost. Thank you, Syria. I appreciate that. I saw someone said the link didn't work, but I ended up Xing myself out. And you make a point, like people were really watching us for an hour. I'm impressed. But then again, they're at home, right? They better be at home. Seema, how are you feeling in this moment? Can't hear you, Seema.
I'm feeling good. Thank you to everybody who tuned in, and everybody who spoke. I learned a lot. It's just really interesting, you know, the impacts that we're all seeing, you know, in our respective fields, and how this pandemic is, you know, really highlighting a lot of the issues that we face, you know, even when we're not in the midst of this crisis, and, you know, I guess allowing us to really shed light and talk about these issues.
Thank you, Seema, and thank you again for being our producer today. One thing we didn't get to talk about is what this means for civic engagement work, which a lot of y'all, Seema was our Muslim Women Vote Early coordinator, and all of y'all played an important role in our Muslim Women Vote Early efforts for our bus tour. We didn't end up having a bus tour because that's when we realized we want to be responsible before our own state and government didn't make those decisions. We decided to just show up at the polling station. So I think maybe, you know, on that note, maybe our next conversation with folks online is what we did in that time. What does it look like moving forward? Why do politics matter? We all know that the electoral process alone won't liberate us. It's a lot of community organizing. So I just want to thank everyone for joining us. I want to thank the Social Justice and Advocacy Committee. And I want to say right now in this moment, alhamdulillah, because of all of y'all, I do feel hopeful. I believe that we will come out of this. And this isn't about just keeping yourself safe or just your family healthy. This is about saving lives in this time of coronavirus, not by just those who are infected with the virus, but those who are impacted by the socioeconomic injustice, the environmental injustice, the racial injustice, and let this show and reveal and unleash the real ugliness of this system that has been oppressing so many people here in the States and across the world, really, and how we can be better citizens, better residents of this world. So Jazakallah khair and Barakallah fikum for all of y'all. We pray that you all are healthy, safe, stay at home, stay at home, stay at home. And we pray that y'all are in high spirits. Until next time, Assalamu alaikum.